when a regulator confirms that a member of its staff has a declared financial connection through a spouse to the manufacturer of drugs it oversees. The issue isn't whether rules were followed. The issue is whether public confidence can survive without independent scrutiny. Today, I'm looking at why a growing number of pet owners are asking for an independent review of the UK's Veterinary Medicines Regulator, and why that request matters. The confirmed facts: the UK's Veterinary Medicines Directorate, known as the VMD, has confirmed in a Freedom of Information response that one of its employees has a spouse who owns shares in Zoetis, the manufacturer of the osteoarthritis drugs Librela and Solensia. The VMD has stated that it has established protocols requiring staff to declare conflicts of interest, and that individuals who make such declarations are excluded from product assessments. Why this disclosure matters: while the VMD says these safeguards are effective, campaigners argue that the issue goes beyond internal compliance. Regulatory systems rely not only on rules, but on public trust, and trust depends on transparency, independence, and the ability to verify assurances externally. Disputed safety interpretations: Zoetis maintains that extensive global use, tens of millions of doses, supports the safety and efficacy of Librela and Solensia, with adverse events classified as rare or very rare under European Medicines Agency definitions. However, a campaign group known as Say No to Librela and Solensia in the UK disputes this interpretation, citing what it describes as an independent analysis of available data suggesting a higher incidence of serious adverse events. These competing interpretations have not been reconciled through an independent regulatory review. Regulatory position: the VMD has stated that it continues to monitor both products and remains confident that their overall benefit-risk balance is positive. Critics argue that without an external review, assurances from the same body that authorized the drugs may not be sufficient to restore public confidence, particularly when safety figures are contested. Legal and professional context: a class action brought in the United States concerning Librela was recently dismissed by a New Jersey court. That decision addressed procedural and legal thresholds, not a definitive assessment of product safety. Campaigners say this has intensified concerns among pet owners who feel there is no clear avenue for independent examination of their experiences. Why timing matters: at the same time, Zoetis' newer osteoarthritis treatments, including Lenivia and Portela, are receiving regulatory approval in other jurisdictions. This raises a broader question: should regulatory expansion continue while trust in existing oversight is under strain? This discussion is not about assigning blame, alleging wrongdoing, or discouraging veterinary treatment. It is about whether independent review mechanisms are being used when confidence in regulation is clearly being challenged, and whether transparency is being treated as a strength rather than a risk.